If the umbilical cord fell off and there's a little mass remaining, what's going on? Well, it could be a polyp, it could be a granuloma. We will talk about the distinctions of both and what the treatment options are. So let's get going with that. An umbilical granuloma is a little mass that can persist after the umbilical cord falls off. You'll see it in the belly button. It will be a little round, slightly pinkish ball with some yellow fluid coming off of it, and it just doesn't want to dry out. This can persist for usually up to a week, and then oftentimes it will resolve on its own. But sometimes it won't. Sometimes it needs a little bit of treatment to go away, and if they're very large, sometimes they need to be removed surgically. It's important that these do resolve because a little moist ball right around the belly button can lead to infection in the area, and it's important to take care of that. A polyp tends to be a little bit more pink or red, and also they tend to bleed a little bit more. So if you try to wipe them or touch them, they want to ooze and bleed a little bit more. These are very rare. These can actually be connected a little bit more to what's going on inside your baby, so it's important that they're dealt with, and this is going to require a pediatric surgeon or someone a little more skilled to take care of them should a polyp actually exist. You go into the pediatric office, your baby has a little granuloma, what are they likely to do? Typically, the pediatrician or the doctor taking care of your baby is going to take a stick of something called silver nitrate, dab it in a little bit of water, and touch the tip of that granuloma. It's going to dry it out. It's also going to turn the skin a little bit black wherever that swab touches the skin. And that's going to stay black for about a week before finally it flakes off and goes away. Nothing to worry about, not very harmful. You might notice that the pediatrician should have worn gloves if they didn't, because if they touch their skin while doing this, their hands are going to be black for about a week. Polyps, on the other hand, they tend to persist. And if the doctor treating the baby thinks it might have been a granuloma and tries to dry it out with silver nitrate, it's not going to go away. It's going to persist, and it tends to bleed more. That's going to be the first clue that we're probably dealing with a polyp instead of a granuloma, and that's the baby that needs to be seen by the pediatric surgeon to take care of that. The fact is, polyps and granulomas can look identical, and that's why when bumps don't go away with simple treatment, the doctor starts to think polyps. Again, it's important to treat these masses regardless of whether it's a granuloma or a polyp, because these areas can lead to infection if they don't heal properly. And also, polyps can have a little bit more significance and need a little bit more investigation should that be occurring in your baby. Fortunately, granulomas are not too common and polyps are very rare. What is more common are umbilical hernias. We're going to talk about that in part 5. Your shares and likes mean a lot to me, and no freaking out if your baby should happen to have a granuloma or polyp.